Hey everyone, thanks for joining us. This is Dr. Noah Erickson of Innovative Family Wellness, and I want to address an important issue that many people think about when they're buying a home or moving into a new apartment. You have a building inspector test your place for mold, right? Maybe you're cleaning your bathroom and you notice around your shower or your sink or faucets, perhaps a window seal where a little bit of moisture accumulates, you see some black mold. Other than that, we don't think about that as a cause for fatigue, for abnormal hormones, low testosterone, estrogen, thyroid problems. So perhaps you're having problems with sudden onset of weight gain. And of course, you go to the doctor and you have normal labs. You generally start to ask yourself about diet, hormones, supplements, but mold toxicity is a major problem. And over the years, many people with chronic fatigue, sinusitis, red eyes, nasal drainage, allergies, asthma, they've had this condition and it's never been properly diagnosed or recognized. So I'd like to give you a little example. Just say you walk into an old courthouse, maybe your grandmother's basement, an old garage, maybe you're in a bedroom or a room in a house that happens to be over a crawl space, and you notice you feel congested, stuffy, brain fog, or what I sometimes call everyday mental malfunction. Perhaps you feel a bit asthmatic. You can't get a full, deep, satisfying, refreshing breath. This could be mold toxicity. So unfortunately, testing for mold isn't as simple as going and getting your blood pressure checked. It's not just a one test. It's a collection of symptoms that we have to gather during the evaluation. So trained in functional medicine, using the techniques of investigation with scientific testing is how we finally arrive at this. And it takes an in-depth consultation and examination. Acknowledging your symptoms, again, fatigue, sudden onset of weight gain, everyday mental malfunction, bloating, brain fog, skin rashes, allergies, asthma. So mold exposure can present like a lot of common medical conditions, but have nothing to do with those common conditions like anemia or thyroid that would be normal medical explanations of fatigue. So here's what we often find. We find that somebody has these issues and they end up going on prescription estrogen, testosterone, cortisol. But here's a secret, a little clinical pearl, if you will. When you use those prescription bioidentical hormones, they can actually make this worse. And the reason being is there's a hormone, and it's called your body's hormones, and a little chemical there called aromatase. This condition of mold alters that and actually changes that whole expression. So hormones can take and make you worse. Hi, Ahmed. Thanks so much for joining us. Good to see you again. And here's something else. On blood work of thyroid, you'll have normal lab results. So what's going on here? We find out on lab, they often have elevated cortisol. You have an abnormal level of leptin, right? That explains that insatiable craving for carbs. I always tease people and say, I'm a recovering carboholic. Some 20 years ago, I had something called yeast, which, by the way, that candida or yeast ties in tightly to mold exposure and mimics a lot of the symptoms. And I was a carboholic. So yes, it is true. Many people have this condition, and you have this insatiable appetite for bread, pizza, pasta, carbs, basically, right? You become a carboholic. So what's happening here? You're feeding that infection, and just like me years ago with the yeast infection, I tease and say in your belly, you have a microbrewery. So molds release mycotoxins. And here at Innovative Family Wellness, not only do I do the salivary hormone testing, ruling out adrenal fatigue, elevated cortisol, as probable tie-ins to what's going on with mold exposure, we do test the blood work of vitamin D and thyroid hormones. There's a special urinary test that we do that's very exclusive to mold. And most of you know me too as work with the genetics, right? The MTHFR mutation. That plays a role. But there's a different set of genes here that we look at for mold exposure. It's estimated only about 1% of the population has this, but if you have this, you will be that person laying in that bedroom above a crawl space, waking up with allergies, congestion. You will be that person who walks into a library, opens up an old set of encyclopedias, if you know what they are actually. Now we have Wikipedia. But anyhow, you'll be in those type of places and you'll feel brain fog, fatigue, confusion, red eyes, watery eyes, postnasal drainage, sneezing, asthmatic, and it doesn't appear why. So these results that we look at on the urinary testing, on the blood work, the saliva, really help us understand what's going on. And there's some very unique tests too that we do that help us give understanding, like TGF-beta and VEGF, which often are high and low respectively, that give me more insight. So remember, if you're suffering from these type of conditions and signs and symptoms, and you've been everywhere, you've been through conventional medicine, consider mold testing. So there's many strains of mold. It can appear in your basement, your garage, your bathroom, but it's a big deal. And something interesting, and again, a lot of you know me from working with children, a lot of children end up in school classrooms or old gymnasiums that have mold toxicity, and that's a big deal. I'm hearkening back to a case that I had. This goes back about 4.5 years ago. We had a beautiful young girl who was in her early years in college, and she recalls that around age 17, in her junior year in high school, she had major problems in school. Hey, good morning, Kristen. Nice to see you. Happy Easter. And she had some major problems with focusing, depression, and anxiety. What had happened is she turned to substance abuse to deal with the pain, the depression, the anxiety. It was the only way she could get a good night's sleep. But unfortunately, many people with mold exposure pass this off. Really interesting point. She said by Thursday, late in the week of an average typical school week, she felt terrible. Brain fog, anxiety, depression, and she told me something interesting. By Monday morning, she'd start to turn the corner and feel better again. So despite her school psychiatrist and counselor telling her that she probably had school anxiety, she said it doesn't make sense. Monday mornings, at the onset of my entire school week, I actually feel so much better. So what that's telling me is something that she's exposed to. Interesting enough, when she went back to her school in Ohio, after we came and successfully treated her, she was able to take cultures from the air ducts, and she pulled back some of the insulation and the carpeting in this particular room where she'd noticed she'd have racing mind, panic, anxiety, could not focus and concentrate, and there was mold discovered. So there's many types of mold, some black mold, which is that common typical mold. Like I said, it might be in your basement, but it can be everywhere. So think about this. It can be airborne, it can be transmitted outside, it can be in basements, garages, homes, schools, colleges, libraries. So these are some of the indicators, almost like the canary in the coal mine, that helped me with her case. So in her case, here's what we had to do. Mold toxicity testing was performed both urine, saliva, and blood to get this full profile. And this is the trick. We have to get inside the body cell to detox the junk and use binders. Folks out there, if you've been treated for mold toxicity and your brain fog's going away, but you just don't have complete resolution, word searching, names, dates, places, maybe you can't do math so well anymore, perhaps you just kind of feel like you're in the moment, but you're not living in the moment like you're fully engaged. You know you're physically present, but you kind of feel a little spacey, like your body's there, but you just feel like you're not fully living in the moment. What can happen is this. The mycotoxins are released from die-off, which is a great thing, right? You're finally getting deep into this and you're getting rid of these toxins. Binders are the key. Look, after 13 years of practice, a lot has been revealed to me through patients and treatments. We have to get inside the cell, detox that using critical antioxidants and nutrients like glutathione, which help pump out the junk. Hey, good morning, Bill. Nice to see you. Happy Good Friday. And I tell people this, once the junk comes out, if it's not collected and caught, you're going to recirculate the toxins, right? Almost like going and changing your air filter in your furnace, but not actually doing the duct work and cleaning it out well, you still recirculate the toxins. Did you ever buy an old car and you get inside and you turn on the air conditioner and it's like, wow, what's coming out of the ducts? I feel, allergic, congested, or sinusy. I don't feel well. You're recirculating the toxins back through. Same thing with your body. So if you pump out the junk, but you don't sequester or capture it, unfortunately, you're going to recirculate those toxins. Hey, good morning, John, and nice to see you. Thanks for tuning in. So what's really neat is you have to find out how you can capture this stuff, right? And pull it out. Because toxins in, toxins out, you want to give them a conduit, basically, or a pathway of leaving. And if you don't bind them, then you're going to recirculate them. And now you can have more brain fog. And something else is very kind of subtle in the beginning, but during detox, very active, skin rashes. Children have this, adults have this, odd patches on their skin, red rashes, breakouts. This is a huge indicator for me that mold mycotoxins are now coming out. So bind onto them, right? Capture them. And that's something I specialize in here. We have over 500 nutritional products. We use customary diets. We use specialized pharmaceutical grade supplements to do this. So what I can tell you over the years is I try my best to identify mold. And even though it may not show, there's still a principle in naturopathic medicine that we implement. And that is a principle of treating the whole person from the inside out with a drug-free, natural approach, right? That's most of the whole concept of functional medicine. What systems and cellular pathways and signaling mechanisms are off in your body. So when we use this protocol, we're getting rid of mold, we're capturing the mycotoxins so you do not have these kind of reactions, brain fog, headaches, the die-off reactions of skin rashes and bloating and indigestion. Joining me on this episode here of mold toxicity and allergies and headaches, mold exposure. It's a big deal and it's just under-recognized. So again, if you've been suffering and you're not getting answers, please consider this, okay? We're always here to help. I'm Dr. Noah Erickson from Innovative Family Wellness. We have a website, that's innovativefamilywellness.com. And if something I said to you about your children has intrigued you, please check us out at Dr. Noah's Ark. That's my name, Noah, so it's Dr. Noah, and then Ark is A-R-C, so it's Dr. Noah's Ark. Check us out there. Be glad to help you through your problems, and always be glad to talk to you and give you some advice when it comes to mold testing. Thanks again for joining me this morning. Wishing everybody a good Friday and a very blessed and happy Easter. Take care, everyone. Thanks again. Bye.